Do you hate being stressed and anxious every time the pain comes? Perhaps you've been familiar with a trigger, like sitting for too long, or I had a CEO tell me one time that every 5 minutes into the meeting, he gets the migraines. And every time he goes into the meeting, he is triggered when the timer goes off for 5 minutes. So you see, the way pain works, it is actually establishes a pattern that is predictable for you. And if it has been dragged on long enough, what happens is it starts to affect your social centers, it starts to affect your emotional centers, and it starts to affect your mental status. So this is where pain goes beyond the physical. And I want to give you 3 tips today so that you can actually gain some clarity as to how to snap out of that trigger. Because if that trigger is literally something you can define right now, you are not in a good place, because now pain has got a grip on you instead of you're having a grip on the pain. Because when you have a grip on the pain, you can work around it, you can rehab through it, you can exercise through it, you can actually do therapy and treatment through it, and that is where you are in control. But if you aren't in control and the trigger has got you by your spine or your tail, you got to understand that this is a more severe situation than what you think. And the 3 steps that I want to exhort you and encourage you to take really is, what have you got inside of you that you have not utilized? Of course, you guys know that I'm a chiropractic physician, a holistic doctor. Of course, I talk and preach and teach and treat patients using the spine care to start off. But besides spine care, is there something else that is that is inside of you, but you haven't quite used yet? So perhaps you know that sitting for 40 minutes is not good for you because you start to have pain. So have you actually done something about it to get out of that pain? If you know that lying on that pillow will cause you pain, have you actually taken steps to buy a new pillow? Or have you this exercise helps you to reduce your migraines. Have you actually done that exercise? So I want that first point out of the 3 to be a reminder for you to take action. Now, second one, identify the emotion. Because most people take action only when that emotion gets more and more constant, more persistent, and more severe. So if you can identify the very emotion that trigger caused you when you feel the pain, perhaps for that CEO I talked about earlier, 5 minutes into that meeting, he gets triggered and he feels anxious, right? So if you can identify anxiety as a problem, then you can now gauge how much you need to take action based on how much anxiety you have. And last but not least, ask the spine. So click the description link down below, because I will help you ask the spine how to get you out of pain. Take care.